Radio silence. Okay.
Okay.
Okay, we are live.
Hello, and welcome to our Facebook Live series, Ask the Vision Loss Experts Coping with COVID-19. My name is Dr. Trisha Grant, and I'm the Senior Director of Low Vision Research at the Chicago Lighthouse.
And I'm Dr. Brian Walensky, and I'm a low vision optometrist in New York City, and I work with Orcam Technologies. It is our intent in this series to bring up topics and engage people and share information as pertains to vision loss during this time of COVID-19 and social isolation. And in these episodes, we want to bring in guests and talk about topics that concern the community during this time.
And we welcome everyone to join, whether you or a loved one are visually impaired or blind, or you just want to learn more about the experiences of people who have vision loss, especially during this time.
So thanks everybody for joining us each week. If you know someone who may benefit from these discussions, we just ask you to take a moment and hit that share button on this post. So cities around the world are beginning to open up. It's great. It's happening here in New York. We finally got phase 1. What are they in Chicago, Dr. Grant?
Phase 3.
Wow, okay. You guys
we're speeding ahead, yeah.
We always want to ask what our question of the day is. So what is, the question of the day today is, and everybody please comment below, and we'll read it later, is what is the first thing that you did or you are planning to do when you leave the house? So when we'll come back to it later, we'll go over what we're doing as well and what everybody else has been up to.
And today, if you are noticing, we just have a guest joining us today, and this is Dr. Kara Crumbliss. And Dr. Kara Crumbliss is the Vice President of Clinical Services at the Chicago Lighthouse, where she oversees the vision clinic and practices vision rehabilitation. She is also the coordinator of the Illinois College of Optometry's Low Vision and Geriatric Ocular Disease Residency, and an associate clinical professor in primary care services at the Illinois Eye Institute. Her research and lecture interests include the association of low vision with Charles Bonet syndrome, cognitive impairment, and Alzheimer's disease. Dr. Crumbliss earned a Doctor of Optometry degree from the Illinois College of Optometry, where she's also completed her residency in low vision and ocular disease, in addition to the Dike Center for Visual Rehabilitation. She is a fellow of the American Academy of Optometry and a member of the Associations of Schools and Colleges of Optometry's Low Vision Educators Special Interest Group. And I don't know where she finds the time, but she is also an executive board member of the Illinois Society for the Prevention of Blindness.
So welcome, Dr. Crumbliss. Thank you for being here.
Thanks for having me. Hi, everyone.
Oh, I think we have some technical difficulties. Are you still there?
I'm still here.
Okay, we hear you now. Great.
Can you hear me?
Here. Yes, we hear you, but it comes in and out a little bit. Let's see if you can answer our question of the day. We'll use that as a little test. What we always want to do is all our guests, when they come in, we ask them, the question we're asking everybody else, which is, what have you done or planning to do once your city opens?
Oh, well, yeah, as Dr. Grant mentioned, well, we're in phase 3. So the first thing I did on June 3rd was go and get my hair colored and done. And then as far as leisure activities, I've been looking forward to boating. I've been very thankful that the majority of our stay at home was kind of in that colder transition into approaching summer. So yeah, anxious to kind of hit the water and relax.
No, that sounds great. This is my favorite season is summer. Get on the water, get to the beaches. So I'm looking forward to that too when the time comes. But many people are returning to normal activities, just like we're talking about, and things that we want to do since we've been all cooped up at home. One of those things is not only routine visits to our doctors, but routine eye care, which you provide. We know patients are still hesitant. I've witnessed that as well about coming into a healthcare facility, especially at-risk patients. So what type of changes have you made in your clinic?
Yeah, so we've made a lot of changes to try and relieve people's anxiety and make sure we as the providers and our patients stay safe and minimize their risk of contracting COVID-19. we're screening all our patients for symptoms, whether they've been in contact with someone with COVID, then we obviously ask them to stay home and quarantine for the appropriate time. We check for a temperature when patients come into the office, and then of course follow all of the increased disinfection procedures. In order to make sure we're adhering to all those disinfection procedures, we're spacing appointments more so that our patients aren't overlapping and running into one another. We have reduced seating area in our waiting rooms, and we're asking many patients to wait in their car, though being in a low vision practice, we are understanding of the fact that many of our patients don't drive. And so we've made accommodations for that as well. And in our exam rooms, we have additional sneeze guards, both at check-in and as well with some of the equipment that we use. I'm sure you're doing a lot of the same.
That's great to hear. Those are a lot of changes. And I went into the clinic last week myself, and I was really surprised and impressed to see how great it looks. I think you're all doing a really fabulous job with keeping the patient safe. So what can a patient expect during their visit? What's going to be different from the past, if anything at all?
Well, in addition to kind of those common questions, a lot of doctors are kind of doing away with white coats because they weren't laundered every day. So
right.
I'm in my scrubs here. I'm in the clinic today. A lot of doctors are either adopting scrubs or getting rid of ties, dry clean clothes, or they're wearing kind of street clothes that can be laundered at the end of any shift, just to make sure that we're keeping everything there clean. So seeing your doctor without a white coat is a little bit different. Obviously, everyone's wearing a mask at all times, and we're also having our patients wear a medical grade mask when they're in the clinic, not just their cloth mask. But for our patients with vision loss, that poses an additional challenge for them to see my face and recognize me. Additionally, things like history and our discussion with the patient is minimized in advance of the exam or from a further distance. And again, a lot of persons with partial sight need you to get close so that they can see you. We have face shields that allow us to get a little bit closer so that patients can get a view of us. In addition, for patients that are really anxious, but they do want to still come into the clinic and are in that high risk category, our first of day appointments, when the office has been freshly disinfected overnight, just like the senior shopping hours, we're offering those first of day appointments reserved for those higher risk patients.
That's great.
That's very smart. I didn't think about early morning appointments. That's one thing I didn't. I know I'm getting used to seeing patients as well, doing things differently. That little guard, that shield, we call it the breath shield or sneeze guard. I hate using it because it gets in my way, but it's necessary and it's needed. In the past, we spoke with your colleague, Dr. Scherer, and we talked about telehealth services and how is that going? And is, now that you're opening up, is that going to still continue?
Yeah, so we're definitely still encouraging patients, especially those in that high risk category, to comply with staying at home when possible. And so we want to make sure that that is possible for them. So telehealth is still something that we are offering and encouraging. I have usually 1 or 2 telehealth visits each day. And we can accomplish a fair bit in our phone conversations with the patient or our virtual meetings, and then prescribe kind of empirically, this is the magnifier or the devices I think are going to be best for you, mail them to the patient and gather some feedback. And then occupational therapy has revised guidelines that still permit home care. So occupational therapists can follow up and go into the patient's home so that they can comply with that. And in that one-on-one setting, it keeps the patient safe and provide additional training with some of the devices that we've sent.
That's great. So it sounds like you're implementing a lot of safety precautions and you've put a lot of thought into how to really take care of your patients. Is it a realistic expectation? Do you think that similar changes are being made across the country and beyond? Are you following national or even international guidelines when you're determining what types of changes need to be made?
Yeah, I mean, this is certainly not an individual effort. We've done a lot of research and a lot of collaboration with colleagues and discussion with colleagues. You know, the primary guidance comes from the Centers for Disease Control and Prevention, has guidelines specific to healthcare providers. The World Health Organization and the American Academy of Ophthalmology and American Academy of Optometry have also done courses and have online resources for us. So there's been a lot of guidelines out there for us. But a lot of them overlook the sight disabled and even the disabled population in general, and some of their specific needs aren't mentioned in these guidelines. So we've worked to adapt some of those things specific to our patient population, even things like sighted guide for patients coming into the office. A lot of patients are being encouraged to come in, you know, by themselves, but for people with vision impairment, especially coming into an unfamiliar environment, they often use a guide. So we're allowing one person to come in and accompany them, or if they come in by themselves and it's an unfamiliar environment, we can use a cane distance. We hold one end of the cane and the person holds the other end of their cane. We can use that to guide safely with distance. Or when needed, we just don appropriate PPE for a brief period while we help assist them and escort them into the office.
Great recommendations. I just wanted to remind everybody, I'm Dr. Brian Walensky. This is Dr. Tricia Grant, and we're here talking about topics that affect those with vision loss during COVID-19 and discussing topics. And here we have Dr. Crumbliss today, who's a low vision optometrist at the Chicago Lighthouse, and getting some perspective on things that are opening up and what to expect in the exam room and during and what's going on really in healthcare and eye care. You know, there are a lot of safety measures that we're talking about that are being put in, and reducing the risk of COVID-19 transmission. We still need to think about that to our patients. But what are some other factors that, that you that we should all consider?
You know, I think this is just kind of a new and unfamiliar experience for all of us. I had a healthcare
I think we're losing Dr. Crumbliss a bit.
I think we are.
But, you know, we talk about the white coat syndrome, and I said, well, we've kind of lost the white coat, at least for now, temporarily. But white coat syndrome being where someone experiences elevated blood pressure around, you know, often thought due to anxiety over a medical visit. You know, without our white coats, this is still, you know, can cause anxiety. A person's wand coming out. Oh, hold on. Let's see. Can we fix this?
I think you're doing better. I think we're hearing better. You're coming in and out a little bit, Dr. Crumbliss.
Yeah, you're coming in and out, and we apologize to the audience, but this is, as we said, when we go live, these things happen. No, you're a little bit in and out. But I think what we want to do is just recap a lot of the things that Dr. Crumbliss said. I think she's gone to
That's much better.
We hear you now.
And actually, before we lose you there, are you still there?
Technical difficulties. Anything?
Oh yeah, there you go.
Okay.
Good. There is one thing
Yes.
to get to before we lose you again, because this was an important one.
Yeah, sorry about that.
That's okay.
Still, maybe I'll
You
still
mentioned
here.
you mentioned that you have a research interest. Specifically, I heard something about Charles Bonet syndrome, and I really wanted to get to this. So I'm hoping we can still have you there. You had some good insight when we spoke about how it may affect people while they're home. Can you explain the syndrome to our audience and more of what we spoke about when we spoke? So I think we lost Dr. Crumbliss. And all right, that's what happens when we go live.
Yeah.
That's okay. But,
yeah.
But what I wanted to get at with Dr. Crumbliss is that she actually is interested in research and talking about something called Charles Bonet syndrome. And I did want to bring it up because it was in her bio. What Charles Bonet syndrome is. And
Sure. So I really find Charles Bonet syndrome fascinating. Hold on.
Do we have you? All right.
Yeah, I think we're going to have to sign off with Dr. Crumbliss just because, unfortunately, I know she has a lot of other, a lot to say. But the point, what we really wanted to drive here is that Dr. Crumbliss has really done a lot. She's done an incredible job with preparing the clinic for patients to return. She's read all of the guidelines, she's following them. And we could really use this as a model. I think we're going to talk about this a little bit more, Dr. Linsky and I, of how to implement some of these changes even around your community and how to advocate for that. So we want to thank Dr. Crumbliss for coming. We apologize that I think the service in the Chicago Lighthouse sometimes is a little bit off in certain areas. So that's probably the issue that she's experiencing. But thank you, Dr. Crumbliss, for being here, for sharing all your thoughts with us. We really appreciate it. And someone actually commented she might want to hear. Stephanie, I think it's Berman Sims, said, OMG, what a treat, love Dr. Crumbliss. So Dr. Crumbliss has a very good reputation, obviously, and people were happy that she was here today. So thank you, Dr. Crumbliss, for being with us.
I was going to mention that before she left about Stephanie saying that that's great.
That's a nice comment.
Because you're there caring about your patients and
absolutely
also a safe environment, which we're all doing. So it's great.
Exactly.
That you're so loved.
I think I think it's really demonstrated in that comment and how she's taking care of her patients. So thank you again, Dr. Crumbliss. And if you would like to contact Dr. Crumbliss, please visit www.chicagolighthouse.org and type in Ask the Experts in the search menu. It will bring you to our webpage where you can find Dr. Crumbliss's contact information. You'll be able to link to actually all of the clinical services. We'll put a link there. And then you can link to our resources that we've mentioned here during our past discussions, and also you can watch some of our past conversations as well. So the direct link will be posted in the comment section below.
Yes, definitely. And I will also just mention quickly, because I know we wanted to get on to another topic, about the Charles Bonet syndrome, what it actually is, just so everyone knows quickly. What it is, sort of like a hallucination that someone gets when they lose their sight. So it's sort of like, let's say someone has bilateral macular degeneration. Well, the brain is trying to fill in that blank space. So what it does, it puts in this visual hallucination that people see. And often myself and Dr. Crumbliss and other low vision specialists or the retina specialists will ask, are you seeing any hallucinations? And people go, oh yeah, how did you know? And they don't like to admit it because they feel like that someone's going to think they're going crazy. Well, you're not going crazy. And the point of what we were going to bring up is that people are now at home and might be experiencing that and feel like, okay, what's happening? Or maybe there's an increase of it because you're not doing your daily routine and you're kind of home and bored, and maybe that's coming up again. So it's a normal phenomenon that happens, and it's more of recognizing that you have it is really the recognition of it, and there's really not is the treatment, is recognizing that you have it. So, but Dr. Grant, as an eye doctor, and Dr. Crumbliss will attest to this, 2020 was like going to be this new year, the year of vision. And it seems like so long ago. We were so excited. I mean, not to give away my age, but I graduated optometry school in 2000, 20 years ago. And my class spoke of, wow, in 20 years, we're going to be 20-year anniversary in the year 2020. We're so excited. you know, and now we're here preparing for all the challenges and going into practice for what this new normal is, sort of what Dr. Crumbliss was saying about all the different techniques and all the things that we're going to need to do in practice, all the PPE, all the sneeze guard that we're going to have up, you know, utilizing the cane length of people away, different challenges that we face. And it reminds me of all the challenges that my patients with vision loss have.
Right.
So we're all going through these challenges together to make the environment, the exam room environment, and places like the Chicago Lighthouse, to people to feel safe and protecting each other. So we're all going through this together with all of these challenges.
Yeah, I agree. And Vision 2020, you know, on the research side, it was a big year for us too. So we did not anticipate all of these different, you know, all these new changes that we'd have to make. So it's been a very interesting year to say the least. But this makes me think of when we spoke to Dr. Smith way back when we first started, and he talked about coping and adapting to new situations, and he gave us a lot of good coping strategies. And this just tells us that coping and adapting is not a one and done. You don't just cope and adapt and you're done. It's an ongoing process to continue to adapt to the situations around you. So we can think back to some of those coping mechanisms and things that he talked to us about, you know, arming yourself with information, knowing what you're going through, what to expect, all of those things help you deal with coping. And then just the individual strategies, if you're feeling a lot of anxiety about what's going on, the different things you can do, meditation, you know, taking walks, just all the things you can do to kind of clear your head during this time. And just to know, like you said, Dr. Lindsay, we're all in this together. This is a new experience for everyone. So I think there's comfort in that as well.
But I am happy that things are starting to open up. So we asked our question of the day before, you know, what is everyone, what you did it already or whether you're going to. So Dr. Grant, what are you up to? What are you going to be doing for your first thing to get out during phase 3?
I did go see family, and we sat out on the patio and just talked, and that was really nice. It's weird not seeing my sisters and my mom as often as I do. So we did that, and I owe my dad a visit. I know he's watching. I'll be there. But what I really want to do also is just go to the beach, and I believe the beach is just open here. So hoping to find just a quiet area. I like to just sit on the water, read, listen to music, all of that. So I really can't wait to do that. How about you?
Well, I can't wait to see my niece and nephews. And I'm on FaceTime with them like every other day. And my brother lives, out in Long Island, and I have another brother in Brooklyn. And we usually, they're in the summertime, like to get together. And it's been fun. So I'd really love to do that. As far as something, more that's family, to see my family I miss them. The other thing is I'm going to try this weekend actually to see a friend of mine in Queens and explore his neighborhood, just kind of walk around and things are because things are opening up. So we want to see that. To sort of go around the neighborhood. We're gonna, he's been nervous about traveling in his neighborhood because he has a guide dog and he's nervous about the social interactions and how far away is he from someone. But we're gonna go out together and we're gonna explore it together. So I think that's a good way to do it. So we wanna read some comments from some other people, what they said. So Giovanni Bahina, hopefully I said that right, said, have a day off. So taking today, doing something to hang with the girlfriend.
Oh, nice.
Good, of course.
And it's Giovanni is, I know he's in Chicago, so it's a really beautiful day today to do that. So good for him. Day off sounds really nice. Who else? Stephanie. Oh, I like this. She said, I plan to improve my hula hoop skills outside in the yard. And then she said, look out, neighbors. So this is a warning to the neighbors that Stephanie will be hula hooping. And that's such a good exercise. My dad, several years ago, he had a weighted hula hoop. So it's like a good exercise and a fun activity. So have fun with that. That sounds like a good time.
I like how she says, look out, neighbors. So it's like they always say, dance like nobody's watching. So
exactly.
Have fun with it.
Hula hoop like no one's watching.
Sure.
This week our theme is obviously cities opening up, and this discussion made us think about the social distancing rules, and we work in this field. So we thought about, have people who have vision loss really been considered in the design of public spaces for, different stores and different public areas that are trying to help people follow these rules. Are they considering people who have visual impairment? So we read a really great article, and we want to share some of the things that we found in there. This article is by Medical Express, and it really dives into this problem and helps highlight the different concerns, that we've already thought about, but it gave perspectives of people and what they're going through. So one of the examples is a grocery store, and how they have now markers on the floor to say, if you're waiting to check out, this is 6 feet, this is 6 feet, etc. And then down the aisles at the end of each aisle, they have one way or the other. But, everyone I've seen has been visual. So, you ask, how do people, can they implement tactile markers on the floor and help guide a little bit better? So that's really something to think about. What other types of things did you think about?
Going into an elevator. Of course, people like where I'm working 2 days a week, they only allow 4 people in the elevator at once. And if you live in a building like mine, really, you can only put 1 person in there, because only 2 really can fit in there in the past, and you'd squeeze together, but you really don't want to be doing that still. You want to still maintain that social distance. So when the elevator comes, you got to ask, is anybody in there? And then the problem is waiting for that door to close. Is it going to close on you before you ask if somebody's in there? So that could prove to be difficult. And I like how you did mention about, the social distancing sort of like markers on the floor.
Yeah.
They're not tactile, but you mentioned that there were tactile ones at the Chicago Lighthouse.
Yeah.
Correct?
Yeah, there are. In certain areas, there are tactile markers on the floor. So again, the Chicago Lighthouse is considering these things and how to make a more inclusive environment. And so this is kind of a lesson. It could even be a model to others. And that's, as we've been talking about, the theme of the show a lot has been to do your part, but to also consider others when you're doing your part. So I challenge everyone to head over to your community grocery stores and ask them, why don't you have tactile markers? And I would say, we should give them benefit of the doubt that they just weren't considering it. So that's a lot of what advocacy is helping people consider things that they didn't consider before. So I've asked the person at the Lighthouse who ordered them to give us that information so that we can share it on our Ask Experts page. And you can take that information to your store and say, and I plan to do that myself. Let's get these tactile markers out there, because they're important for everyone, not just for people who can see them.
I agree. And then the other issue, are people wearing masks? Are they not wearing masks?
Right.
Are other people paying attention? So there are a lot of these issues. And I think it's just something that wasn't before, and we need to, consider those things, and businesses as they open up as well.
Right, absolutely. And then as an individual, if you're on an elevator and there's a couple people in the elevator, you can, be proactive and say, this elevator's full, can you take the next one? And it's, it might come off as rude, but these are things that we have to start getting used to. And I think it's, it's worse if someone on the elevator is sick and you're all together just because you don't want to say the words. So I think there's a polite way to say these things, and maybe just kind of practice them. And, let's practice what we preach. There's an elevator in my building, and I forget, I hop on the elevator with people. And I did do that once, and the woman just aggressively threw herself off the elevator. And so it was just a reminder to me to just be more aware.
Or instead, just hula hoop in the elevator, like Stephanie.
Yeah, hula hoop in the elevator. That's a really great idea.
I really wanted to thank Dr. Crumbliss today. I'm sorry to listeners that we kind of had some technical difficulties with it. See, we're still learning as we go as well.
Absolutely.
So, Dr. Crumbliss, Dr. Grant, anything to leave us with, Dr. Grant?
No, I think that's it. That's all. We just ask everyone continue to consider others as you're navigating our, your open city. Just consider others and be polite.
And everyone be safe. Always remember what I always say is wash your hands. And even if you're wearing gloves out there, don't touch your face.
Yeah.
Be safe, everyone.
Bye.